Hi, I'm Dr. Michele Evans, and I want to talk to you about egg freezing. First, I want to start out with a little bit of history about eggs and what we know. We think that people are born with all of their eggs and use them up during their lifetime. The eggs that we're born with are microscopic, and they're stored in the center of both of our ovaries. During our life, we'll use up these eggs by losing a group of eggs every month. And from the group of eggs that we lose, we'll grow one egg. We do the same process every single month, losing a group each month until all of them are gone. And when all of them are gone, that's when a person goes through menopause. And the average age for menopause is 51. People are born with different numbers of eggs. People use up their eggs at different rates. And of course, people have different genetics in their families. And so these factors will determine how many eggs we have, what our egg supply looks like at different ages, and when our eggs will be gone. When we egg freeze, we're going to grow the group of eggs that would naturally have been lost during that menstrual cycle. So one of the nice things about egg freezing is that it will not use up any of a person's future egg supply. We will only grow the group of eggs that would naturally have been lost, and we will be able to take those and freeze them and save them for later. To start egg freezing, we begin with a consultation where you would come in and discuss your history and your goals, and then we would discuss the preliminary screening tests that need to be done. The screening tests start with egg supply testing. Egg supply testing is easy to do, and it's done with an ultrasound and a blood test. The ultrasound will tell us about how many follicles a person has, which are the fluid collections that surround eggs on our ovaries. The number of follicles that are available depends on a person's remaining egg supply. And on the same day, we would look at a blood test called an AMH level, which stands for anti-Müllerian hormone. This is the hormone that's produced by our remaining eggs. People who have more eggs will have a higher AMH level, and people who have less eggs will have a lower AMH level. So we start with egg supply testing with ultrasound and blood work, and we would also complete some extra lab tests that are called pre-cycle lab work, and these are mandatory tests that are done for anybody that goes through egg freezing. The egg freezing cycle itself uses hormones to grow the group of available eggs. These hormones are called follicle-stimulating hormone and luteinizing hormone. These are given in an injectable form. So to egg freeze, you need to use daily injections of these hormones to grow the group of available eggs. This requires injections for about 8 to 10 days, and during that period of time, you would come in for ultrasound visits to monitor egg growth. When the group of eggs is ready, you would receive your final injection of the egg freezing cycle. That's called a trigger injection. And that's a timed injection that will allow the eggs to mature completely. About 34 to 36 hours after a trigger injection, the eggs are retrieved from your ovaries. Egg retrieval day looks like this. You would come in to the office about an hour before retrieval time. You would go to the procedure area, change into a gown, get an IV in your arm. You would meet our anesthesiologist, you would meet our nursing staff, and your doctor. They would take you to the procedure room, and you would receive medication through your IV so that you would sleep during the retrieval procedure. You're only asleep for about 15 to 20 minutes, breathing on your own and being monitored continuously by our anesthesiologist. The eggs are retrieved using vaginal ultrasound and a needle. The needle goes through the top of the vaginal wall, into the ovary, then into the follicle, which is the fluid collection that surrounds the egg. Each follicle is drained, and hopefully an egg comes from each follicle. The follicles are drained from your right and left ovaries, and then the procedure is over. You go to recovery after your procedure is done, and you're there for about an hour before you get to go home. And before you go home, you will know the number of eggs that were retrieved. We freeze these eggs, and you can use them in the future. The eggs can be stored for many years, can be thawed in the future, fertilized with sperm to create embryos. I hope you found this helpful. If you want more information, please reach out to the office or schedule a consultation.